around and wonder where your sex life went? Now, dry spells can happen to any couple, but it's estimated that they hit married people mostly between 2 to 10 years after they tie the knot. Oh no! While experts say it's common, who wants their sex life to be non-existent? So joining us to discuss why married people sometimes stop having sex and how to get your groove back in the bedroom, we have in our Google Hangout Andy Harris, the founder of bedroomchemist.com, Dr. Irwin Goldstein, the director of sexual medicine at Alvarado Hospital and a clinical professor of surgery at the University of California at San Diego, David Bukhari and John Hooker, a same-sex couple married for 9 years, and Mary Jo Fay, a registered nurse and the author of Please Dear, Not Tonight, The Truth About Women and Sex, What They Want, What They're Not Getting, and Why. Welcome, everybody. Well, this conversation is an important one. We have Enfatico already chiming in. In most unions, sex is always less after marriage. Sex is also less wild, for the most part, after marriage. Andy, you've been married for 13 years. What say you?
Well, I say that, you know what, you got to make an effort. You got to, make sure that you bring your best self to your marriage. And I think having great sex is part of an amazing marriage, and there might be some dry spells, but you've got to work with your partner and make sure that you're keeping things, hot and sexy and spicy, and you're bringing your best self to that relationship.
Not just your best self, but your naked self. You have here this website, bedroomchemist.com. Doctor, I hear you over there laughing. You believe in nudity to save marriages. Or maybe it was the boys. Hello, my friends.
Isn't your best self your naked self?
Yes, absolutely. I should have just said naked self.
And I think that there is a correlation. In my experience, I've been with the same man since 2003. I guess that's now, what, 11 years? And I do think that the more naked you can be, I think transparent personally and also actually naked, the better the relationship is. Mary Jo, you deal with a lot of clients, however, who this is a difficult concept to grasp. The bedroom has not been a happy place for some time. What is the longest you've seen your clients go without sex in the relationship?
18 years was the one.
18 years? Are you sure you didn't mean days or months?
Hours.
You know what? I lead a dating group in Denver and work with a lot of singles, and frequently people write me and ask me various questions. And 5 years I've seen, 10 years I've seen, but when this one man wrote me and said, I've been celibate in my marriage for 18 years. I'm Catholic. I believe in my vows, but would it be considered cheating if I found someone now? And I'm like, 18 years? Oh my God, you should have, done something a long time ago.
Now, what are we defining as sex? Because, I mean, just to get the parameters here, are we talking about P and V or P and P, or does oral sex count? Anything? Is this just lack of intimacy? Or is this the full enchilada that we're talking about, the lack of in the relationship?
In that particular situation, it's lack of interest. So it doesn't matter what particular movements you're doing, it's lack of interest. I don't want it, leave me alone, I have a headache, whatever. And honestly, in this country, 1 in 3 girls and 1 in 6 boys are sexually molested by the time they're 18. So that's, and those figures we believe are certainly underreported. So that's at least 1/3 of our population that has a lot of issues going in the bedroom to start with. And if those aren't addressed, it's only going to get worse.
That's a good point. David and John, jump in here because you have reached the pinnacle of a relationship. You're retired together. My hat is off to you two, sir. I wish that we all could enjoy life naked and retired with our favorite person in the whole wide world like you two. The sexual shame has a lot to do with it. If you are brought up in an environment where sex isn't considered a natural, normal thing, perhaps in your natural, normal marriage, it's hard to keep your freak on.
Yeah. I grew up in a fairly repressed evangelical fundamentalist household. But, fortunately, I discovered sex, and I figured they were wrong.
Good job.
Yes.
Well, we have a comment here from WCAP. I guess you're just roommates at that point. Andy, that's sad. Like, you could have a roommate and probably save a whole lot more in rent than you have a husband or a wife. What do you do to get out of that? You work so hard at the Bedroom Chemist to help people get through their dry spells. We all deal with them. getting back on that horse
Literally.
is an important aspect of this. But it's the buildup that can make the release so difficult.
Yeah, exactly. And so I think one of the problems is the expectations of, you know, oh my gosh, we haven't had sex, we've got to have sex. And so what we really try to do at Bedroom Chemist is we map out the phases. And the first one is just desire. If we can just get couples, they don't even have to, you know, getting back to your comment about the full enchilada, you know, they don't even have to have sex if they just can really start desiring each other again. You know, simple things like give somebody a massage, or, you know, just start kissing or holding hands, or just any type of intimacy. And, you know, it might take them a month before they're ready to really just start having, you know, true sex again. But our thoughts are, you know, just start small, and, you know, don't make this out, you know, don't get a hotel room with candles, and, you know, the expectations get so high then that it's almost a letdown. So the idea is just to get people touching and feeling intimate again. And then what we find is that then that leads to, hey, actually, we do want to have sex. And then the more sex that they're having, the happier they are. And they're like, well, you know, I really was missing out on this. And, you know, obviously there's dry spells with children. And, you know, I have 2 kids of my own. So, you know, there's the natural dry spells. But the point is you've got to get that chemistry back. And so with our kits, that's really the goal, is that every 6 weeks we have a reminder that, hey, do something cool, do Kama Sutra, dress up as a French maid, do just fun, you know, stuff, be silly with your spouse again.
Yeah.
David, are you dressing up like a French maid?
I do. I love my French maid outfit. I will not lie. It's one of my husband's
you have a
favorites.
French maid costume?
I do, and I have even a little duster, because, you know, you can do a lot with a duster.
Does the French maid costume actually get you out of cleaning the house?
Oh, I don't clean. You ask my husband, I don't clean anything without a costume on.
I bet you're cleaning something in that costume, but that's for another conversation.
Right. I'm not using that duster for dusting.
We all could take a page from Laura Henri's book. I like her comment here. We're having more sex after getting married. We had a lot before. It's just gotten better and more frequent, and lots of added goodies. Mary Jo, you have this great book here. Please, dear, Not Tonight, The Truth About Women and Sex. What's the truth about women and sex? How can we all be like Laura Henri? How can we all make marriage not synonymous with sexless?
You know, I think the biggest problem that I see is that most of us learned about sex in the 7th grade locker room from our buddies, and of course they knew everything, right? So the class I teach, called the Intimacy College, which is also tied to this book, is about helping. I teach men about women in the bedroom, and I teach women about themselves. Because women mostly don't have any idea about their own bodies. And so, you know, if they don't know how to take care of themselves, and then they don't know how to share what they want with their partner, then things go bad. And if things go bad too many times, the old headache starts coming around, and that pattern just becomes a constant, and you don't get it fixed. So I really work with people on understanding basic things. I mean, they're all like, oh, is this Tantra? Is this all this other stuff? I'm like, no, this is basic stuff that we don't talk about. We're still a pretty puritanical society outside of porn. So, you know, G-spot, where is it? I can show you how to find it. People are not sure they have it. Basic stuff that really lights up a marriage. And if you're getting satisfaction, you're likely to come back for more.
Exactly. I think that's what's so interesting, is that, you know, we talk to women who have never been in a sex store, you know, or a sex shop, and they, you know, they rely on their husband or their boyfriend to find sex toys for them, and they bring these toys that are just inappropriate for women, or, you know, these giant vibrators that nobody would want anywhere near them. So I think the idea is also just, you know, educating women about what's actually going to really feel good for them.
Right.
Well, some people find, oh goody, I'm so glad you're jumping in here, doctor.
So I'm a sexual medicine physician for 40 years, and I'm really enjoying this conversation, but there's a part of this that's missing. And, you know, you can wear your French maid outfit, you can have fancy cars that have paint on them, but, you know, you need the gas inside the car to have a car that's working. We're missing the biology part of this conversation, and there's a huge amount of biology. It's not just about relationships. It's not just about your partner. There's a lot more to this puzzle. You need to have chemicals in the brain that are balanced. You need to have hormones that are in good working order. As a physician, I can tell you, when we restore the biology, a lot of positive things can happen. And we have a sex therapist in our office. Sex therapy is very important. We do physical therapy also. But I would say to you, an equal part of this is getting the biology in order.
Yeah,
I have so
I
many
think that's
stories.
absolutely true.
I have so many stories. I have a woman who was asexual her whole life. She's a biologist. She lived in Arizona. She was a geologist, and her whole life she has endometriosis, and she got a drug called Lupron to stop the pain of her endometriosis. The first 2 days of a Lupron injection results in a very high testosterone value, and she, for the first time in her 38-year life, knew what it was like to have high testosterone, and she started having sexual thoughts and sexual fantasies. And then, of course, as the Lupron kicked in, she lost all that. And she walked in my office and said, Dr. Goldstein, get me back to those 2 days that I had on that drug. We ended up treating her with testosterone, and now she's dating. She's on these websites. And, you know, it's fabulous to hear all these conversations and books, but please don't ignore the biology. That's my statement to you guys.
Absolutely. I think that's super important. David and John, I want you to jump in here. This comment from W.T. Evington is related to this. The most important sexual organ is still the brain. And as you get older, I know that you guys are sort of a beacon of information for your friends to have candid conversations about being sexual, being in love, and still wanting to get your freak on, but your body not always complying.
Well, you know, yeah, the brain is important, but I think the heart is too, and I think that intimacy really starts way before the erection does or doesn't. It's and so much of what has made our life together great is that not only are we really attracted to each other, but we're really committed to being the best person. So when the biology or the physics of it is not as great as it was when we were 30, it's just not a big deal, you know? We're together, we know how to please each other, and we're committed to seeing that that happens. Does that make sense?
Yeah, but what if the biology said, I'm just going to harp on this, you couldn't have an orgasm? How would you deal with that?
You know, sometimes that happens. Go ahead, David.
Yeah.
And I wanted to agree with you, doctor, because the testosterone, my testosterone level was so low that the desire was really not there. And once we got it to its right level, you're right, it's very different.
God bless you for saying that. Okay,
it's
good.
Very different, doctor.
It is. It is.
You know, you were talking about the brain being the biggest sex organ, and I have to agree on a major scale, especially as it relates to things like a woman needing to say to herself, okay, I can relax enough to have sex. The kids are in bed, garbage is out, the lunch is packed. My husband called me at lunch and checked in to see how I was, and then, my God, he did the dishes all by himself. That's the drug, the magic blue pill that we're looking for women that is never going to happen in my view, because you can get the physiological parts of that going all you want, but if she's still pissed off that you didn't take out the garbage last night, you know, it ain't happening.
There's that book, it's called Porn for Women, and it shows like a guy emptying the dishwasher and a guy vacuuming, and I think that's
by the way,
idea.
there is a drug going to be released next few weeks. So you may say it's never going to happen, but in fact, in 10 days, the FDA will approve a drug for increased interest for women. And the name of the drug is Addy, A-D-D-Y-I, and it will be widely used and be very successful. So you can take the garbage out, but put the biology in working order too.
Oh, I think it takes both, absolutely.
No question.
Yeah,
And
absolutely.
it's nice to have the biology there, trust me.
I love it. I love it. Well, we're working on getting the biology. We have some commenters with their tips of their own. We have Rona Barrymore. Now you know why I wear wigs. Big Daddy loves not knowing what woman he's going to see. So we'll see.
I love it. Keep the mystery. Keep them guessing.
Keep them guessing. And in the interim, let's just work on ourselves. And if we're not feeling it, maybe there's something physiological there, but hopefully there's not. And if there is, get it fixed, because there's nothing better than a healthy sex life. I think we can all agree that that's one of the best things about being in a partnership.
Yes.
Fine.
Yes.
Agreed.
Well,
Big
we
time
aren't having
agreed.
sex, but I'm having a great time, and I'm so grateful that you're here. So thank you so much for joining me tonight. Thank you for your wonderful books and work. All of the information on our guests is in our resource web, which is going to be underneath this video screen. So check out the information on them, because the conversation always continues thanks to you, thanks to your comments, thanks to your video comments, and thanks to you checking out what's coming up next.